Welcome to our channel. Today we're discussing a vital topic that affects millions of people worldwide: cancer. We'll explore its symptoms, risk factors, prevention strategies, and dietary tips to reduce your risk. Let's work together to raise awareness and create a path towards a cancer-free future. Before that, please subscribe to our Tune to Health channel and hit the bell icon to stay tuned for our health-related videos. Now, this short disclaimer: this channel does not offer any medical advice. These videos and all comments and messages are provided solely for educational purposes and are not intended to replace professional medical advice, diagnosis, or treatment. Please always consult with your doctor or other qualified healthcare professionals if you have any health-related questions or concerns. Cancer is a group of diseases that affect any part of the body. It involves abnormal cells that grow and spread uncontrollably, damaging nearby tissues and organs. Normal cells grow, divide, and die in an orderly fashion. Cancer cells, however, continue to grow and divide uncontrollably, forming masses known as tumors. These cells can break away and travel to other parts of the body, forming new tumors in a process called metastasis. Cancer cells are different from normal cells and can disrupt the body's normal functioning. Cancer represents a significant global health, social, and economic burden. In 2018, there were 17 million new cases of cancer worldwide and 9.6 million cancer deaths, making it the second leading cause of death. By 2030, it is projected that there will be 26 million new cancer cases and 17 million cancer deaths per year. The developing world is disproportionately affected by cancer, with approximately 70% of cancer deaths in 2018 occurring in low- and middle-income countries. These deaths often occur in countries with limited or no access to diagnostic services or treatment, and with low per capita expenditure on health care. The most common solid organ malignancies arise in the lung, breast, and gastrointestinal tract, but the most common form worldwide is skin cancer. There are two main types of tumors: benign and malignant. Benign tumors remain localized and do not spread. Malignant tumors, also referred to as neoplasm, malignancy, or cancer, can invade nearby tissues. Symptoms of cancer should never be ignored. Always keep an eye on cancer symptoms and signs, which depend on the stage of cancer and the part of the body involved. I'm going to share some generalized common and specific signs and symptoms of cancer. Generalized common signs and symptoms include unexplained weight loss. Unintentional loss of weight exceeding 10% over 6 months without a clear reason can be a red flag for cancer. Loss of appetite. Loss of appetite without a clear reason can indeed be a symptom of certain types of cancer. Fatigue and malaise, feeling utterly exhausted despite getting rest, can be an early indicator of cancer. Pain. Persistent or severe pain that has no apparent cause and lingers can be a symptom of cancer. Fever. Persistent or recurring fever that defies explanation, especially if it strikes at night, can be a warning sign of cancer. Next, I will discuss specific signs and symptoms of cancer. Different types of cancer affect specific organs and tissues in the body, resulting in distinct signs and symptoms. Although there may be some overlap in symptoms, each type of cancer possesses its own unique characteristics and warning signs. For instance, breast cancer. Breast cancer can manifest with these signs and symptoms: change in breast size or shape, lump or thickening in the breast or underarm, dimpling or puckering of the skin, nipple discharge or inversion, painless swelling in the axilla, hard swelling, blood discharge from nipples, recent history of nipple retractions. Skin cancer. Skin cancer can manifest with these signs and symptoms: change in skin color or texture, bleeding or scabbing that doesn't heal, new or changing mole or growth, non-healing ulcer, painless swelling, change in character of a prior mole. Gut cancer. Gut cancer can manifest with these signs and symptoms: persistent abdominal pain or discomfort, difficulty swallowing, persistent vomiting, loss of weight and loss of appetite, abdominal distension, jaundice, fatigue, blood in the stool or black, tarry stools. Lung cancer. Lung cancer can manifest with these signs and symptoms: chronic cough, blood in the cough, difficulty in breathing, persistent coughing or wheezing, chest pain or shortness of breath, coughing up blood or rust-colored mucus, fatigue or weight loss. Urological cancer. This cancer can manifest with these signs and symptoms: painless hematuria, blood in urine, mucus in urine, painless swelling in flanks, changes in urine frequency and color, persistent rawness, plaque, or nodular thickening in the penile region, rapid onset painless swelling in the testis, loss of testicular sensation. Gynecological cancer. This cancer can manifest with these signs and symptoms: abnormal vaginal bleeding, persistent serous discharge, lower abdominal pain, abdominal distension. Head and neck cancer. Head and neck cancer can manifest with these signs and symptoms: non-healing oral ulcer, white or red patch in the mouth, hoarseness, difficulty opening the mouth, persistent nasal stuffiness and nosebleeds, sensation of a foreign body in the throat, painless thyroid swelling, weight loss and loss of appetite. Brain cancer. Brain cancer can manifest with these signs and symptoms: headaches or fits, nausea or vomiting, memory loss or personality changes, difficulty with balance or coordination, vision or speech problems. Remember, these symptoms can also be caused by other conditions, so it's essential to consult a healthcare professional for proper evaluation and diagnosis. Early detection is crucial, so don't hesitate to seek medical advice if you experience any unusual symptoms. Cancer arises from a complex interplay of genetic and environmental factors. The key triggers include genetic factors. Some people inherit genetic mutations that increase their cancer risk. A family history of cancer can also raise your risk, even without specific mutations. A number of inherited cancer syndromes account for 5 to 10% of all cancers. These syndromes result from inherited mutations in genes that control cell growth and cell death. People with these mutations have a higher risk of cancer, but not everyone with the mutation will develop cancer. Other genetic and environmental factors also play a role. Identifying a genetic contribution is important in cancer management. It can help guide treatment decisions and allow for early detection through screening. Environmental factors. Environmental triggers for cancer have mainly been identified through epidemiological studies. Many environmental factors can cause cancer. For example, tobacco smoke. Smoking is now established beyond all doubt as a major cause of lung cancer and many other cancers. However, there are additional predisposing factors, as not all smokers develop cancer. Tobacco smoke has more than 7,000 chemicals. At least 250 of them are known to be harmful, and at least 69 are known to cause cancer. Worldwide, tobacco use is the single greatest avoidable risk factor for cancer mortality. It kills more than 8 million people each year from cancer and other diseases. Nearly 80% of the 1.1 billion smokers in the world live in low and middle-income countries. Radiations. Prolonged exposure to ultraviolet UV radiation from the sun or tanning beds can damage DNA and skin cells, leading to skin cancers. Frequent diagnostic exposure to medical imaging techniques like X-rays and CT scans can increase the risk of cancer over time due to the cumulative effect of ionizing radiation on cellular DNA. Exposure to nuclear fallout following an explosion can release ionizing radiation, which can penetrate the body and damage DNA, increasing the risk of cancers. Occupational exposure. Industries like dye and rubber manufacturing, asbestos mining, construction, and shipbuilding carry a heightened risk of cancer due to exposure to carcinogenic substances. Vinyl chloride used in PVC production and carcinogens present in the petroleum industry further contribute to increased cancer risk. Modifiable risk factors. Many modifiable risk factors can increase the risk of cancer. For example, alcohol consumption, obesity, sedentary lifestyle, a diet low in fruits and vegetables, a diet high in processed foods. Many factors can increase cancer risk, including bacterial, viral, and parasitic infections. Hormone replacement therapy, particularly the use of estrogens and diethylstilbestrol, can elevate the risk of cancers like vaginal, endometrial, and breast cancer. Chronic inflammatory diseases also heighten cancer risk. Additionally, age is a significant factor, as the risk of most cancers rises with age due to accumulating genetic mutations. Gender differences in hormone levels and reproductive anatomy can also influence cancer susceptibility. Cancer is largely preventable, with prevention offering the most cost-effective long-term strategy for control. 30 to 40% of cancers can be prevented, and early diagnosis and treatment can cure 1/3 of cases. Join the movement for cancer prevention. These tips aren't mere suggestions, they're life-changing habits that can significantly impact your overall well-being. Let's explore these amazing tips together to reduce the risk of cancer. Number 1. Avoid tobacco. Refrain from all forms of tobacco, such as cigarettes, cigars, and smokeless tobacco. Smoking stands as a primary cause of cancer, and quitting can substantially diminish your risk. Number 2. Restrict alcohol consumption. According to the International Agency on Research of Cancer, alcohol is classified as a toxic, psychoactive substance with addictive properties. It's labeled a Group 1 carcinogen, directly linked to 7 cancer types, such as esophageal, liver, colon, and breast cancers. Additionally, alcohol consumption is linked to 740,000 new cancer cases. Globally, 1 in every 20 breast cancer cases is attributed to alcohol intake. Avoiding alcohol can help reduce the risk of cancer. 3. Shield your skin. Shield your skin from harmful UV rays. Wear sunscreen, protective clothing, and seek shade when outdoors. This can reduce the risk of skin cancer. 4. Avoid a sedentary lifestyle. Avoiding a sedentary lifestyle is a preventative against cancer because regular physical activity helps maintain a healthy weight, improves immune function, and reduces inflammation, all of which contribute to lower cancer risk. Additionally, exercise can regulate hormone levels and enhance the body's ability to repair damaged DNA, further reducing the likelihood of cancer development. 5. Adopt a healthy diet plan. A healthy diet rich in fruits, vegetables, and whole grains defends against cancer by providing vital nutrients and antioxidants, supporting immune function, and aiding weight maintenance. Next, we'll discuss the best foods to eat. Omega-3 rich foods. A diet rich in omega-3 fatty acids from sources like salmon, sardines, and walnuts can reduce inflammation, promote healthy cell function, and potentially lower the risk of cancer through anti-inflammatory properties and support of immune function. Avocados. Avocados, rich in monosaturated fats, fiber, and vitamin E, aid cancer prevention by reducing inflammation and supporting healthy cells. Whole grains. Adding whole grains to your diet supports digestion, offers antioxidants, aids weight management, and lowers inflammation, reducing cancer risk. Blueberries. Adding blueberries to your diet as part of a balanced and nutritious eating pattern can help reduce cancer risk by providing antioxidants, anti-inflammatory compounds, and essential nutrients that support overall health, including a variety of foods such as apples, carrots, cherries, cauliflower, legumes, spinach, tomatoes, and grapes in your diet can help lower the risk of cancer, as they are packed with antioxidants, vitamins, and fiber essential for maintaining overall health and well-being. No single food can protect against cancer, but research shows that a diet rich in vegetables, fruits, whole grains, beans, and other plant foods can lower the risk of many cancers. There are different types of recommended drinks to consume. Green tea, carrot juice, and berry smoothies can be very beneficial drinks to reduce cancer risk. They are rich in antioxidants, vitamins, and other nutrients to help protect against cell damage and support overall health. Now I'll discuss some bad foods to avoid. These are sugary foods. High consumption of sugary foods can lead to obesity, a risk factor for many types of cancer. Red meat. Consuming large amounts of red meat like beef, pork, and lamb can increase cancer risk. Processed meats, such as sausages, hot dogs, and bacon, can increase cancer risk. Fried foods. Foods cooked at high temperatures, especially fried, can contain potential carcinogens. Processed foods. These are foods that are high in preservatives, additives, and artificial ingredients. They can increase your cancer risk. Avoiding such foods can reduce the risk of cancer. Other bad drinks to avoid include energy drinks, alcoholic beverages, sweetened tea and coffee, processed fruit juices, and artificially sweetened beverages. They are linked to an increase of cancer due to their high sugar, caffeine, and additive content. Cutting down on these drinks will help reduce cancer risk and promote better health. Furthermore, you should minimize contact with cancer-causing substances. Reduce your exposure to environmental carcinogens by avoiding asbestos and radon in your home and workplace, limiting contact with harmful chemicals in your job and daily life, minimizing exposure to ionizing radiation from sources like X-rays. Periodic medical examinations also help. Ensuring your health remains a priority. Scheduling routine checkups with your healthcare provider is essential. These appointments provide an opportunity to tailor cancer prevention strategies and screening recommendations, address any concerns or symptoms, and receive guidance on maintaining a healthy lifestyle. Vaccinations are important as well. Certain viruses like hepatitis B and HPV can heighten your cancer risk. Vaccination against these can shield you from this threat. The hepatitis B vaccine averts liver cancer, while the HPV vaccine guards against cervical, anal, and other cancers. Embracing vaccination substantially diminishes your risk of developing these cancers. Speak to your healthcare provider promptly to discuss vaccination options. Adhering to preventive measures significantly lowers cancer risk. From balanced diets to avoiding harmful exposures, each step fosters a healthier future. Proactive health management is vital. Take charge today to reduce your cancer risk. Thanks so much for watching this video. Don't forget to follow us for more helpful content. And if you like this video, subscribe to the channel and give it a thumbs up.